I'm Eunji, fellowship in Neurosurgical department. I prepare CCA occlusion case with various ECA, ICA collaterals, and 67-year-old female, and she had TIA 5 months ago, recurrent motor aphasia, and the 2019 MRI showed left ICA occlusion, CCA occlusion, and in this moment, there's some impaction in the left MCA territory, and there's no definite change in the TOF images. And this is CCA-gram and show that the stump in the proximal CCA segment and the left subclavian arteriogram show that very tortuous and good collateral from the thyrocervical trunk to ascending cervical artery and coast cervical trunk to deep cervical artery to occipital artery and reconstitution to the ICA. And this is diagram show that the way and occipital collaterals. And I do selective angiography in this thyrocervical trunk. And we can see the delayed pace that the ICA segment is identified. Also, I mentioned it, the ascending cervical trunk and artery and deep cervical artery reconstitution to the ECA and IC. Also, she had very good Willisonian collateral from the right CCA-gram, show that ACOM is very patent and good supply to ACA and MCA territories. And I mentioned about this superior thyroid collaterals to the contralateral ICA to ICA. And I cannot select the vertebral artery because very tortuous anatomy, so this is the right side subclavian arteriogram, and there's no definite steno-occlusive lesions. So I review the MRA before the angiography. We also can find the collateral and the ICA, ECA to thyrocervical trunk. So, and they do also carotid Doppler, and there's no flow in left CCA. And also there's no flow in the left proximal ICA. ECA and vertebral artery flow is not that significant increased. So I reviewed some paper, and some author called that the carotid artery steal syndrome. They found some collaterals, and I mentioned about this collateral also. I reviewed this case because kind of simple, but 제가 잘 보지 못했던 콜라테랄들을 잘 관찰할 수 있어서 케이스를 리뷰했습니다.
Do you know which collaterals you are actually talking? Do you see any of these vessels? Which vessels are? I commented last time, we passed the stage of just talking about this external carotid, subclavian artery, or cervical arteries. Okay? You have to be more specific. And there's enormous collaterals in case of any internal carotid or external carotid artery is occluded. The source of the collateral always comes ipsilateral first, closest connection first, then distant connection of ipsilateral, and then it goes contralateral. Okay, that's the sequence how the collaterals are developed. You have extensive collateral from cervical arteries to external carotid artery. Cervical arteries are more of metameric orientation, including occipital artery. You know what metamere means? What metamere is, we are all metameric origin, whole body. Segment. Each segment gives off central nervous system, peripheral nervous system, bone, soft tissue, muscle, skin, including our cervical areas, is a metameric. Metameric, especially cervical areas, there is a three vascular system comes from metameric arrangement. One is deep cervical artery, the other one ascending cervical artery, and vertebral artery. These are ascending cervical and deep cervical artery, and the connecting to the vertebral artery, and vertebral artery is coming down and reconstituting the internal carotid artery this way. So occlusion is from this segment that was common, right? This is antegrade to the internal carotid artery. And you see the contralateral side injection has a retrograde flow. So you do have a bidirectional flow, what I'm trying to say. This you saw before, right? This is more embryonic arrangement. This is Pierre made this drawing in 1982. You know, when I was fellow in NYU, Pierre was visiting and he immediately came in and he put it on a big drawer and he drew this. Everything about external carotid artery is here. If you understand this diagram, this picture, you understand all the external carotid artery system. What I'm trying to say is this is all the vessels are connected, and this one connected as you can put it on here on the face. The internal, this red is internal maxillary artery, green is pharyngo-occipital artery, and blue is facial lingual, thyroidal, and violet is cervical area. This connected segment all has collaterals. After I finished with spent the time with Pierre in Paris, and we made this diagram, and I had to put it all collateral vessels, which is seen here. You have this your Pierre's book there. Go back and look at this and see what kind of collaterals existing. What you are seeing here is this cervical portion. You have a collateral from the C1, C2, and C3, and lower cranial nerve. It means, ascending pharyngeal artery. Ascending pharyngeal artery has a very important collaterals. If you look at it, this is vertebral artery injection, which we see this large vessel supplying paraganglioma. This is what we have here. Ascending pharyngeal artery going back and filling vertebral artery this way. So-called odontoid process arterial arcade. So that also gives a very important collateral to vertebral to external, same as occipital artery. This is written in that textbook, right? So find it and see what type of collaterals are existing.